So this is, again, the Rural Health Innovation Information Session. And Rural Health Innovation is a fully funded scholarship opportunity for students who are admitted to our online Masters in Public Health program. So again, this is a really incredible opportunity to earn your Master's in Public Health degree online while staying in the community that you're already living in, staying in the work that you're already working on, while getting your degree funded in full. We're really proud to offer this and excited to share more with you today. And we'll go over to our agenda to introduce the various topics that we're going to cover. So we'll introduce the folks on our call in just a moment. And we're going to talk also about the mission, vision, and values, both of the online MPH program and also the Rural Health Innovation Scholarship Program. We're going to talk about sort of the vision of this program, and then we'll dive into logistics. What does it mean to be an RHI scholar versus a fellow? What is the format of this program? How do you apply? Things like that. So we, again, hope that this is informative, and if we don't cover your questions in our formal presentation, we'll make time for Q&A at the end. So on our call, I'll introduce myself first. My name is Elise Rudolph. I'm the Director of Online Admissions and Recruitment with our online MPH program. You'll hear from Stephanie in just a moment, but I work alongside Stephanie and we are your admissions team. So my role alongside Stephanie is to help make the application process straightforward and to assist you in putting your best foot forward. And Annie, may I pass it along to you to introduce yourself?
Sure, thank you. I'm Annie, or Ann Drobno, and I am the fellowship manager for the Rural Health Innovation Program and fellowship manager more broadly for kind of all of our fellowships in the online MPH program. And I wear kind of many hats within the RHI journey, including awarding the tuition and fees, and cover all kind of more of the finance and budget side of things, as well as help guide our students, RHI students, through the unique practicum experience, which we'll talk about more later, as well as attend a conference with 10 of our fellows in Washington, D.C., again, which I'll talk about later. So nice to see you all, and great to be here. Stephanie, I'll pass it to you.
Yeah, thank you. Welcome everyone once again. I have had the pleasure of meeting with some of you, but if it's our first time, it's so lovely to have you on the call. My name is Stephanie Nguyen, and my pronouns she, her. I am the online education recruitment manager, and I essentially support students with exploring the program, helping you learn a little bit more about the logistics, and really working with you as your thought partner throughout the admissions process. So if you have any questions and would like any one-on-one advising, I am available as your support and your guidance throughout that process. So applications, admissions, program questions, usually I am the first stop. And as Elise mentioned, we work very closely together and are just happy to have you here. Thank you.
Awesome. Thank you so much, Annie and Stephanie, for your introductions and for all that you do to support our RHI students. Hopefully we have some folks on the call who will become part of that community. So this is sort of an overview of, what the RHI program looks like. So you'll see at the very top, starting from the top left, this is once again a fully funded scholarship. We're really grateful to have an extremely generous donor who has committed to funding 100 full-time working professionals to earn their master's in public health degree through UC Berkeley. So the goal is 100 fully funded scholars. Right now in the program, we've had 2 cycles of RHI already, and so there are 80 students already in the program, and we are recruiting what may be our final cohort of rural health innovation students. You'll see the next number, it says we're seeking 20 RHI scholars. So because we awarded 80 already, we're looking to award 20 additional scholars this spring. So that would be to start the program in January of 2025. Of the 20 incoming students in spring who we award, we will select 10 of them to become what we call policy fellows. So if you have a specific interest in policy and advocacy work, there is an opportunity to sort of further specialize this program to focus on those policy and advocacy elements by becoming a policy fellow. Now, moving to the bottom row here, these are just some logistics about the online MPH program. So as part of the Rural Health Innovation Scholarship Program, you'll also be in our online Masters in Public Health program. And that program requires that students come to campus twice over the course of this 27-month program. We'll talk more about this in a moment, but you'll have an opportunity to visit Berkeley 2 times, once in each summer of the program. We're actually in the midst of our summer visits right now, so all of our online students are on campus, which is really fun and exciting. And what's really great is that the Rural Health Innovation Scholarship pays for all of your travel, your room and board while you're here. So we will cover all of that if you're in this program. Again, it's a 27-month program, and we are an exceptional online MPH program. Obviously, I'm biased, but but we have the background to back that up. We've been around for over 12 years. We are consistently ranked very highly amongst online Masters in Public Health programs. UC Berkeley's School of Public Health has been contributing to the field of public health for decades, including really important and cutting edge research that is now used in the public health field routinely by professionals. So this is definitely an excellent place to learn and get an education, let alone the fact that you could do that all for free. All right, so we want to talk about the mission, vision, and values of our online MPH program. So as I mentioned, we've been around a while, and we have a pretty good sense of who we are as a program and as a community. Our mission is healthy people locally and globally. We want to extend Berkeley's reach to improve population health, especially for the most vulnerable, and provide tools to address pressing public health challenges. There, you can read the bullets on this slide, but essentially, our program values offering this high quality UC Berkeley education in an online modality has actually always been very aligned with the goals of the Rural Health Innovation Program as well. And it's essentially that we don't believe that folks should have to uproot their lives or quit their jobs, relocate to the Bay Area to get this high quality education. We want to make this excellent training, which is the same as our on-campus program, available to working professionals in whatever state they're in, whatever country they're in, whatever time zone they're in. And we have successfully done that for many years. And the other thing that we really believe in is empowering folks who are already doing the work in their communities to upskill, to do it better, to get that public health lens and to make an even bigger impact, so that you can apply the learning that you're doing in the program in real time while you're, in the careers that you're in the communities that you're already a part of. So that's really the goal of our online MPH program. And you can see our values are service and community, showing up with authenticity, growth rooted in justice and equity, cultivating connection through learning, and centering wellness. And with that, I'm going to hand it over to Annie to talk a little bit more specifically about RHI.
Great, thank you, Elise. Yeah, so the Rural Health Innovation Program is relatively new, right? It's, I think, in its second year, but it was really established by Lynn Barr, the donor, to recruit and support, again, a total of 100 students. 80 are currently enrolled. We still have 20 spots left in our Berkeley Online MPH program, who are really based in and dedicating their work to serving rural communities. So the vision of this generous donor who is an alumni of our program, was really to make public health training accessible and affordable to leaders in the rural health field. And in doing so, kind of creating doing our part to kind of create healthier rural communities, more equitable rural healthcare systems, especially in the parts of a country that have a serious need, namely rural areas. So we have had a very successful first year of RHI, really has been a resounding success, echoed by many students in their monthly RHI meetings. And as Elise mentioned, in these, when we get a chance to see them in our summer visits, when you all come to campus. And just this semester, this spring semester, we launched our second cohort of RHI students. So again, we're now recruiting for our third cohort of RHI students to start spring or January of 2026 with those 20 spots. We'll take this slide as well, I believe. Yes. So the 20 rural health scholars chosen for our spring 2026 cohort will study alongside kind of the larger MPH cohort of students. So you really are a OOMP student, an online MPH student first, and then an RHI student kind of is layered on top of that. And within each RHI cohort, a select number of students, usually around 10, are chosen to become policy fellows. Those policy fellows are really students who are really interested in activating change in rural health through policy and advocacy. Our policy fellows attend the National Rural Health Association Policy Institute in Washington, D.C., with both myself and with our donor, Lynn Barr, as well as kind of some partners that we have in our monthly RHI trainings who live in DC and help us with set up visits with elected officials. It's really quite an exciting experience, week-long experience. So all 20 RHI scholars, again, as Elise mentioned, received that fully funded MPH program, tuition and fees. We'll get specific programming on a monthly basis with RHI monthly meetings, as well as the on-campus visit expenses covered. And all RHI students are able to choose any concentration that they wish within our program. So if you are one of the 10 selected as a policy fellow, which you will apply for in around April of your first spring semester, you will, again, also go to DC, meet with elected officials in DC, get some extra policy training and advocacy skills training. And then you will also complete more of a policy-focused practicum project, which I will talk about in a little bit later.
So essentially, the program has a very specific layout. Most students coming into our program are typically enrolled in 6 units per semester. So that's 2 classes, and we run the full cycle. So spring, summer, fall, spring, summer, fall. I have another slide coming up that will give you a visual. And it's a total of 42 units to complete the program and graduate. The timeline that I mentioned is 27 months. So we are 7 semesters total if you're following the traditional method. And the concentrations that we offer are health policy and management, food, nutrition, and population health, interdisciplinary if you're looking for something a little bit more flexible, and epidemiology and biostatistics. So if you're kind of on the fence of figuring out where you see yourself make an appointment with me and we can discuss that together. The type of degree that you would receive is a professional MPH, and The format is 90% online, which is asynchronous. So the baseline of how our instruction works is asynchronous. There is flexibility in the way that you receive your instruction, as they're usually pre-recorded lectures. However, there are ways to have synchronous sessions, which I can get into in the Q&A, but overall it's 10% in person for the summer visits. So we do require 2 campus visits during summer, as Elise alluded to earlier, and it's an exciting time. It's an opportunity for you to take what you're learning in the online environment and be able to meet all your peers and, you know, have that in-person experience as well. So again, format asynchronous is the primary mode of instruction, but there is still a nice rhythm to it. There's still deadlines and there are still structure to the asynchronous format. The course delivery, as I mentioned, and I'll say it multiple times because I really want to ensure that students know it's an asynchronous method, but this really means that you can work at a time of day that's convenient to you, and you're not required to be online at a specific time when you're looking at the lectures. However, for RHI students, there will be components that Annie will speak to in just a moment about what the synchronous sessions look like. The weekly commitment, just for the general program, tends to be about 15 to 17 hours per week. And this would include all of your course assignments, your readings, any deliverable that pertains to school. And I'm going to pass this over to Annie to speak a little bit more about what the activities look like.
Yeah, thank you. So again, yes, the synchronous RHI activities are held on as kind of monthly meetings, cohort meetings. And this is really to infuse kind of this policy and advocacy skills training with a real focus on rural. So we have guest lectures, we have cohort kind of breakout sessions, and we meet one evening per month, usually on a Tuesday or Thursday. 5 p.m. Pacific time has been our normal rhythm for the first 2 cohorts. And you also are get to have a unique practicum experience, but we have more on that later. So I will, I think I will transition to the next slide.
Yeah, so as I mentioned earlier, this is the visual layout of how your program would work. So we are a 7-semester program, and that means that we run all the way through from spring 2026 to spring 2028 if you're going the traditional route. However, some students are able to increase their workload if that's something that you see that works best for you. This is something that you would want to inquire with the program manager, somebody that is assigned to you to handle the kind of like your liaison. They would, you know, advise with you and ensure that you are making the right decision if you're trying to increase your workload. But you can complete the program in 2 years by increasing your units to 9 units if that is something that you see fit for yourself. That happens in year 2 of the program. The first year is very structured. Students have core and breadth classes that they need to take as an incoming student. So, you know, if you are hoping to, you know, change your completion time, that usually happens within year 2.
And for the RHI specific funding, we do ask that RHI scholars and fellows try to finish it within 8 terms. So that's the longest example here on the screen. It does allow for some flexibility if you do have to take a semester off or reduce your workload for life events or work. But it's for kind of for funding purposes and to make sure we allocate funds, you know, properly in a timely manner. We do ask that all funded RHI scholars do finish within 8 terms.
Awesome. So we're going to talk a little bit about the practicum requirement here. So all of our students, to ensure that you're able to have experience in an area that you're interested in have to complete a practicum, which is an exciting part and portion of our program. So students coming into the practicum space will have to complete a minimum of 130 hours, and that should be dedicated to your practicum. And this can be something that's worked out with the practicum consultant. You'll have a preceptor as well. But I really want students to be able to envision something that you have always wanted to work on in the public health space. This is a good opportunity to take advantage of the practicum. And aside from that, most of our students tend to complete the practicum within a 3 to 4 month period. This is an opportunity for students to gain practical experience. So as I mentioned earlier, many students share that they'll, take something that they learned in the class and apply it into their job, but this is also extended to the practicum. We really want students to be able to kind of make the connection between these different responsibilities and see how it applies into real world experiences. So I'm going to pass this to Annie to speak a little bit more specifically on how this is incorporated from the RHI standpoint, and share a little bit about that there.
Thank you. Yeah, so RHI has kind of adapted the applied practicum experience while keeping hopefully like the core values of it. So just as Stephanie mentioned, this is really an applied practice experience with the hope and opportunity to actually put some theories into practice. So that will be one piece of your RHI experience, and it actually can be shortened hours because there are 2 other pieces of the RHI unique practicum experiences, which are the monthly meetings. So those monthly meetings actually go into your 130 hours. They don't add up to a ton of hours, but let's say 10 to 15 hours a year kind of adds up, and it will give you a chunk of those hours that contribute to your minimum of 130. And then in addition, there's another part, which is kind of more of a community, what we're calling a community inventory. There was definitely a gap in the literature as well as kind of policy field of research that showed that rural kind of bypass issues, as well as access to rural healthcare and equity. And so part of the practicum experience for RHI scholars is to do a little bit of interviews and surveys and data collection on that issue. And we guide you through it. It's very much like a collective experience. But it is an attempt to fill a gap in literature that we hope to use for furthering kind of rural healthcare policy in general. So it's an exciting new component, and I can actually now speak to it confidently because we are our first cohort is going through it now. So I will pass this back to Stephanie.
Thank you. And I'm sure many of you are like, am I eligible? Let's go through this together. So with RHI scholars, we hope that you work or reside in a rural community as defined by HRSA. So if you're unsure, there will be a link. I can always send these out as well for you to check. We also want you to have a deep understanding and passion for improving public health issues, particular to rural communities. This is a scholarship that is very near and dear to the donor. And again, I think there comes with a lot of intentionality behind this. So this is your opportunity to expand on what you're intentional about. And we ask that you have at least 3 to 5 years of post-baccalaureate work experience with a preference of 5 to 7 years of work experience. Management is not required to, or management experience is not required to apply to this. So I would definitely, have a self-assessment and throw your hat in the ring if you feel that you feel in any way that you meet these requirements. Even if you're missing something or you're not quite there yet, all scholarships will be considered. And then for the Rural Policy Fellowship, we ask that you have an interest in policy and advocacy. Fellows are typically selected in summer of 2026 here, and the RHI homepage will have more information here.
Great.
And then moving along with this, as I mentioned, if you're unclear about where your location is at for work or your address, this is typically what is used to do a quick check. It'll tell you in a green box, yes, your address that you type in qualifies, or if you don't, it'll type in a red box, no. So it's the Rural Health Grants Eligibility Analyzer. So this is exactly what you would see if you are unclear. So I would recommend to use this box here.
And I will add that, this is one tool we use to determine if you live in a rural area, as the donor kind of states is definitely an eligibility requirement. However, there have been some exceptions of clear rural residents and rural work that this one tool cannot. It's not so black and white always. So we take that into consideration as well. And please, feel free to include that in your application.
Awesome. So I'll share a little bit more about the application process, what you can expect. So it's good to remember that first and foremost, you need to apply to and gain admission to our online MPH program in order to be considered for the Rural Health Innovation Scholarship. So RHI is sort of a second step after you gain admission to the online Masters in Public Health program. So I want to take a moment to go over what our requirements are for the online MPH. I'll come back to the RHI, which is listed up here at the top, but I'll come back to that. So in order to apply for the online Masters in Public Health, we do have a few prerequisites. So we really love to see some prior work experience, particularly for RHI. We're ideally looking for 3 to 5 years of prior work experience. More is, of course, better, but we want to see that you're fairly rooted in your work, that you have some on the ground experience that you can apply to your classroom learning. We're also looking for a minimum of a 3.0 GPA from your undergrad. If you haven't met this requirement, which it's a campus requirement, it's not specific to our program. So if you haven't met this requirement, definitely talk to Stephanie or myself. We can help you put your best foot forward or show some other evidence of academic success and academic ability. We definitely have admitted folks who haven't met that 3.0. So required materials, there are 2 essays you'll be asked to submit, your statement of purpose and a personal history statement. We can share more if there are questions about how those 2 essays are different. I'm happy to share more at the end, but there are 2 distinct essays. We require 3 letters of recommendation from either academic or professional sources. If you've been out of school for a while, it's completely okay to use all professional references. Just make sure it's no friends or family. We do need to see transcripts from every institution you've attended. So if you did community college and then transferred to a 4-year, if you studied abroad for a semester, if you did some prior graduate work, and we need to see all of those transcripts. So please send them to us. Unofficials are completely okay though. We're going to look specifically at your advanced GPA. So you'll see something linked here, your advanced GPA calculation. We've also linked this on the website. But essentially, what we specifically like to look at is your GPA from everything after your first 2 years of undergraduate work. We realize that those first 2 years of undergrad are often a transition period, and your GPA from those last 2 years tends to be a little more favorable. So that's what we're looking for you to include is your advanced GPA. We want to see a resume or CV with work experience. documented proof of work experience. So specifically for RHI, we just want to verify that you are in fact working in the place that you say you're working. And then there is an application fee of $135. Some really good news is that we don't require the GRE, so you don't have to worry about taking that exam. If you did take it, you can send us your scores, but if you haven't, don't worry about it. And then if you completed your undergraduate degree in a location where English wasn't the primary language, you may need to submit a TOEFL score. So those are what we're looking for as part of your application to the online MPH. And just to kind of give some information about how the review works. So as I mentioned, there will be a review committee who reviews your application for admission to the online MPH program. And that's going to be a separate committee from the folks who are reviewing your scholarship application. And I think that's really important to remember because when you're completing your supplemental RHI application, those folks might not have access to your larger application file. So you want to make sure it's okay. So essentially what I'm saying is it's okay to repeat yourself in your RHI application and your program application, your Master's in Public Health program application, because it's going to be different committees. And you definitely want to be really specific in your RHI application about the rural health work that you're doing. Because again, if you talk about that in your essays, and then you answer, the same, or you answer your questions in your RHI application and you reference things that you said in your essays, it might not be the same folks reading both. And so you just want to be really specific. Happy again to answer any questions about that process at the end. I'm going to circle back up and just reiterate some of the things that Stephanie and Annie already shared about RHI eligibility. So if you are admitted to the online Master's in Public Health program, then you'll go on to be reviewed for the scholarship. And we're definitely looking for folks ideally who are doing that boots on the ground, rural health work, living and working in rural communities. So we are giving preference in the review process to those who are both residing and working in rural, designated rural areas. If you are one or the other, you live full-time in a rural community, but your work isn't maybe exclusive to that county, or you serve a rural community, but the headquarters of your office is in an urban area. We understand that there are some of these nuances. And so what we recommend is if you feel that you are a strong candidate for this scholarship, please apply, throw your hat in the ring, make a case for yourself. And then, just keep in mind that there might be preference given to those who both live and work. But if you're somewhere in between, we just invite you to make a strong case for yourself. Great. And I'll hand it back to Stephanie to close us out.
Thank you. So the admissions timeline below will show that we are accepting applications until August 3rd. So if you are strongly considering, make sure that you get both your application for the online MPH program and the scholarships completed by this deadline here. And the decisions will release typically late September, maybe even early October. That can happen as well, but we're aiming for late September. And the scholarships typically come afterwards. So you'll get your decision letter first for general admission. And then from October 17th and onward is when we will release the scholarship decisions separately. And then the program instruction will begin on January 2026. So there's a lot of structured timing, and I'm excited, and hopefully we'll see your application. And then next slide, please. And as we mentioned, there are many ways to stay connected with us. So if you feel that you need one-on-one advising, I'm available. You can always book with me. I want to say that in the next few weeks, the slots have been really booking up quickly. So reach out to me if you don't see any specific dates that work for you with suggested times and dates and times, all Pacific time, please. And I'll do my best to accommodate you. I want to ensure that you have my full support throughout this admissions process. And we do have other workshops. So if you are interested in checking out the graduate writing workshop, this will be held on June 11th at 5:30 p.m. Pacific time. We will cover general tips on how to separate the two essays, what they're asking for, and just give you some general tips around that if you're interested. I also encourage you to check out our socials. This is where we have up-to-date events, where we cover commencement and sometimes the summer visits that's happening right now, and just things that are happening with the school if you're interested in staying in touch with us. So primarily LinkedIn and Instagram are two of our popular socials that we love to post updates at. So check us out there, stay in touch with us, and thank you again for staying with us, and I hope that this was valuable for you.